Session on Ask Me Anything related to breastfeeding your baby. Myself, Dr. Tanima Singhal, and I welcome you all on this enlightening session on Ask Me Anything. So first, as per our schedule, first I'll take the questions which are there on the Google form, and then I'll take the live questions. So first question is from Baranda Jyoti. If my percentage of hemoglobin after baby's birth is 7%, does it affect milk supply? Yes, definitely. If your hemoglobin is 7%, so imagine the oxygen carrying capacity of your cells is so low. So your body will preserve all the nutrition for itself. It will not help you to make more milk supply for your child. You yourself are nutrition deficient. Then how will your body make more milk? So yes, Jyoti, it will definitely affect your milk supply. So have your hemoglobin raised up, and at 7%, I am very sure you would be advised to take IV drips. So please go for that. Next question is from Chitali Bagga. My child sometimes do not take milk from my breast and sometimes does. So basically, Chitali, this is common when the babies are also bottle fed. So if your baby is also bottle fed, or if you are feeding by nipple shields, sometimes the babies have nipple confusion. So what happens? They are sometimes feeding on the breast and sometimes they are not. And also it will happen if they are like, if the flow of the milk is less or the supply is less. If the baby is not getting it properly, then obviously the baby will start refusing. And this will mostly happen in the afternoons or evenings or night. Mornings, the baby will be better performing on the breast because in the night there is a hormone called as prolactin released in our body. That's why early morning milk supply is better for the mothers. But by afternoon or by evening, it starts going down. So babies become more cranky. So if your baby is coming on the breast and sometimes not, first of all, remove the bottle. Second thing, work on your flow and work on your supply. Third is that try to take rest in between so that you get a proper oxytocin flow and prolactin increase will be there in your, like have more skin to skin with your child. All these things will help. Next question is from Shruti. What to do to bond with baby during and after breastfeeding? It's a beautiful question. Just whenever you're feeding the baby, just open your chest is already open. Just open baby's clothes from the front, few buttons, and keep the baby skin to skin. And just have a skin like eye to eye contact with them. But yes, make sure you're not talking to them, because babies after 3 months they start blabbering, they start talking, and we as mothers find it so cute, and we want to talk to the babies, and then they get distracted. They feel that they are getting attention. They try to talk to the mother, and then obviously they will not feed properly. They will play. They will feed for some time, and then they will look to you, and then they will feed, and this thing continues. So bonding, this, you can hold the baby close to you, and but don't like try not to talk to them. So this thing will work. Next question is from Yogita. Can I start my breastfeeding journey after 3 months? Yes, definitely, Yogita. You can definitely start your breastfeeding after 3 months. That's not a problem. You can definitely start after 3 months. Next question is from Ashwi. How to check if the baby is feeding well and it is normal for babies to be more gassy in general? So if the baby, how to know? First, I'll answer your first question. It is how to check if the baby is feeding well. So you have to see the active feeding. So you can imagine when we drink any liquids, we can see the gulping movement in our necks. So same way you will observe your child while the baby is breastfeeding. So if you see the gulping movements, that means your baby is feeding well. Second thing is also you see the weight gain of your child. If your baby is gaining weight properly, that means your baby is feeding well. Next question is it normal for babies to be more gassy in general? So if the babies are formula fed along with breastfeeding, then obviously because of two milks, the babies will be tend to gassy. And if the baby is on exclusive breastfeeding, then if the latch is shallow, if the baby is sucking a lot of air with the breastfeeding, that time the baby will be more gassy. So make sure your latch is deep so that the baby is doesn't suck a lot of air and the colic or gassy thing is not there. Next question is from Mati. How many minutes we need to pump per session? Do we need to continue pumping even if the milk collection is in drops or no milk? So here again, two questions. So first I'll answer the first part of the question. How many minutes we need to pump per session? So Mati, now imagine that your baby takes around 50 ml per feed. Okay, now if you are seeing the baby takes suppose 8 sessions. So 5 8s are 40, 400 ml. So this you know about formula milk, or if you are pumping your milk and giving to your child. Now for 1 week, if you are pumping, then whatever milk you are collecting, you have to see the weight gain of your child in that particular week, and you have to see how much formula you have given to your child. Now next week, when we talk of the second week, so you are giving some formula milk and you see the weight gain has been there. Next week, you start reducing the formula milk and see if your pumping sessions are giving you better amount and you are able to reduce formula per week. So if this happens very well, then whatever time you are pumping your breast, that is perfectly fine. But if you are seeing that after every week, your formula milk is not decreasing or not increasing, or the weight of the baby is not decreasing. Sorry, the weight of the baby is not increasing. That means you have to increase your particular sessions, frequency of pumping sessions, and also maybe the duration. So all this thing needs to be worked upon together with you, so that we can understand how many times you are giving formula milk, what is the weight gain of the baby, what weight gain of the baby, how much milk you are collecting, and how many times you are doing pump. So there are a lot of things which are involved into this. This needs to be worked upon with the mother. Second part you have asked, do we need to continue pumping even if the milk collection is in drops or no milk? So if you're working on relactation and your milk supply has gone zero or again has gone into drops, now how will you make your mind or make your body understand that it has to start making milk? You have to, obviously you need to create the demand. So now in this case, when your milk supply is zero or milk supply is drops, then during the demands, you might not see initially, you might not see much milk, but you need to create that demand regularly for your brain to understand that demand and start making milk. So yes, if you ask me at the second part of the question, do we need to continue pumping even if the milk collection is in drops or no milk? So yes, if you are trying to improve your milk supply, then yes, you have to improve the demand and you have to keep doing the demand. And slowly, if you do keep doing the consistent efforts, and at the same time, if you keep doing that, you will definitely get results. Next question is from Nivetha Srinivas. My baby feeds for 20 minutes on each breast and still cries. How do I know if my baby's hunger is satisfied? Okay. So now, first of all, you have to check that your baby has taken active feeding for 20 minutes. So active feeding, I just answered how to check by seeing the gulping. Second part, once your baby finishes the breastfeeding, you just press the breast and see the color of the milk. If the color of the milk is thin white, that means the baby has emptied the breast. But if you see after 20 minutes of breastfeeding, even you are seeing that the milk color is thick white still, that means your baby has not emptied the breast and the baby has taken only the fore milk. So in that case, the baby will keep crying because baby has not got the hind milk. So the baby's hunger has not yet been satisfied. So in that case, either you breastfeed the baby from the same side, or if you are seeing the baby is very cranky and is not getting satisfied and is not ready to feed on the same side, then you shift the baby to the other breast and let the baby feed, but knowing that the first breast has not been emptied. In that case, you need to just pump or hand express the hind milk and give the baby once the baby settled on from the other breast. If the baby is not getting settled by both the breasts and you are seeing hind milk present in both the breasts, that means your latching needs to be worked upon. Your baby is not latching properly to empty the breast. So all these things need to be worked upon. So you will understand that is your baby getting enough or not. And still, if everything is going fine, you're not giving any formula milk, baby's weight gain is also there, then you need to make sure that during your flow should improve. The baby might be feeding for long, but the baby is not getting proper flow of milk. So all these things need to be considered when we are talking about if the baby is crying even after hunger. Next question is from Rakhi. How to manage nipple pain due to direct breastfeeding? So direct breastfeeding, if you are having nipple pain, then that means it is a shallow latch. So now let me tell you how you can improve your latching and you can have a deep latch. So now all of you present here, everybody touch your tongue to the upper palate of your mouth. At the back, you will see there is a dome kind of a place. So human anatomy is in a way, human mouth anatomy is in a way that the mother's nipple should go and rest there. Okay. So that way nipple will be safe and secure, and the hard part of the palate, Just behind the teeth, you can see. This is the hard part of the palate. So this part has to be on the areola. So the hard part on the areola will make sure that the baby gets proper milk. So here now, how will you ensure that it is possible? So when you are putting the baby on the breast, just make sure that the baby's head is little extended. Most of you are feeding the baby when the baby is looking down like this. All of you check today. When you are breastfeeding the baby, your baby should not be looking down or looking straight. The baby should be looking little up. Now why? Because gulping. Now, if you are looking down and drinking something, it will become difficult for you to gulp. While if you open the neck, it will be easy for you to gulp. So that's why when you're taking the baby on the breast, you have to make sure the baby's head is little extended. So once the baby's head is extended, your nipple will be pointing towards the upper palate, not in the middle of the mouth. So if your nipple is pointed towards the nipple of the mouth, obviously it will pain. So because the baby will not be able to take nipple a lot backside. Otherwise, the baby will start gagging. So the baby will do a shallow latch and it will pain. But once the head is extended, the nipple will be pointing towards the upper palate and there will be enough space for the nipple to get rest there. And the baby's lower lip and the baby's this front palate will be, hard palate will be on the areola. So this will make sure that you are having a deep latch. So this way your nipple pain will go up. नेक्स्ट क्वेश्चन इज फ्रॉम शिल्पी कुमारी, बिल्कुल भी मिल्क सप्लाई नहीं है। तो शिल्पी अगर बिल्कुल भी सप्लाई नहीं है तो अभी आप क्या वेट कर रहे हो बेटा जी? आपको कल 3 को फौरन कांटेक्ट करना है, डॉक्टर्स के साथ कंसल्टेशन लेना है और अपना इशू रिजॉल्व करना है। अगर बिल्कुल भी मिल्क सप्लाई नहीं है तो अभी आप किस चीज का वेट कर रहे हो? फटाफट काम करो और फटाफट मिल्क सप्लाई इंप्रूव करो जिससे आप ब्रेस्ट फीडिंग को एंजॉय कर सको। नेक्स्ट क्वेश्चन इज फ्रॉम आरती, हैविंग लैचिंग इशू। So right now, Aarti, just I told you about the latching thing, how you can get your baby on a deep latch. Just work on that and obviously your baby will have a proper latching. Next question is from Ankita. Namaste ma'am, I am under treatment. My son is 12 weeks old now. He never breastfed. I am trying to bring him on the breast, but the moment I put him in my lap, he starts crying. He doesn't cooperate until full and then he falls asleep. What should I do? Supply is increasing. What is the probability of a baby like him coming on the breast? I feel demotivated at times when he behaves like this. Yes. Basically, Ankita, what happens if the baby has been on the bottle fed for long, if the baby is 3 months plus, obviously they start understanding the bottle. And yes, you mentioned 12 weeks, definitely. So what will happen? This time they understand the bottle's flow. That's why they do that. Now, first of all, make sure you're doing your massage in the compresses regularly so that the flow of the milk is well maintained. Second thing, lot of skin to skin is required for these kind of babies who are preferring bottle over the breast. So have lot of cuddling sessions. Even when you are bottle feeding the child, just hold the baby close to you. Third thing, like as I said right now, that when you, like as you mentioned right now, just when you are putting the baby on the lap, he starts crying. That means he has understood that you are going to breastfeed him. So for few days, this is basically a sign of breast refusal, or what we can say as what one term we use as just give me 1 minute, I'll just remember that. Aversion. Yes, breast aversion. This is breast aversion. So what you have to do for few days, please don't try to put him on the breast. Just hold him close to you, skin to skin. Don't take him towards the breast. He should get back that kind of confidence in you that my mother is not going to try me to put me on the breast. You just hold him and cuddle him. Just give him some time. 4-5 days, he will forget this experience. Because now when you're saying that he's coming on the lap and crying, that means he has got that breast aversion. So give him some time. Let him settle down. In this time, just hold him skin to skin. Don't take him towards the breast. Few days, he will forget that. Now, what you will do when you are doing skin to skin during night specifically, when he's little sleepy or when he's full, just take him on the breast and cuddle with him. So what will happen when you bring him towards the breast? There is a natural affinity of the babies towards their mother's breast. So when you take them in the night, when they are sleepy and when they are little not so much hungry at that time, when you take him, he might just come on the breast and just lick on it or just suck for 1-2 seconds and might leave. It's okay. It's okay. It's okay. Just keep doing that. Keep repeating that. And once this starts happening, you will have your confidence. And anyhow, your milk supply is improving as you are saying, and you are saying that the baby is getting satisfied, all these things are there. So right now, just focus on the same thing, that you have to decrease all the formula and get the baby on exclusive breastfeeding with the weight gain. But this point, like bringing the baby on the breast, this might take more time and take more patience and perseverance. But I say, Ankita, just keep moving. Just follow what I am saying. And I'm seeing that you are regular in the webinars. Keep coming to me. I think if I'm not mistaken, you are Ankita Shastri, what I remember. So if you, because your name is just mentioned, your surname is not there. So if you are saying person, that is good, that you are coming regularly in the webinars, just keep discussing with me. I like to discuss all these things. So keep coming. Just give him this week, you just give him, just don't put him on the breast, just put him skin to skin with you. And after 1 week, just try to take him on the breast when he's little sleepy. And also one more thing. Now imagine if you're fed by somebody, and if they are giving you the feed, like just pushing that in your mouth, you will not like it. If they are showing you the food and you are coming forward and taking it, that will be better. So this is called as baby-led feeding when we talk about solids, but it works here also. So once your baby gets accustomed to you on skin to skin, then while he's asleep, when he gets up in the night, just take him towards the breast and let him do whatever he wants. He might just lick, he might just take for a few seconds, he might not take. But just keep doing this consistently and with peace of mind. Right now, your peace of mind should be that my baby is at least getting my milk. That is the most important part. This part, I'll keep working on that and I'll keep doing that. Okay, Ankita? So that's all for the questions. Now let me see the live questions which are there. First question is from anonymous attendee. Hi ma'am, how to encourage baby to do active feeding? My 4-month-old baby comes to the breast and latches as well, but then he only comfort nurses and goes to sleep. On unlatching, he finds the breast in his sleep and starts sucking again. He takes a bottle shortly afterwards. This happens in almost all his feeds. Thanks. So basically, because the baby is taking both the feedings, direct feeding also and breastfeeding also. He finds comfort with the mother, and that's why he wants to take the breast in his mouth. Now, what you have to do in this, while the baby is on the breast, you need to see the sucklings. So if you are seeing that the suckles are there, the gulping is there, that means he is already doing an active feeding. But if you are not seeing that he's just moving his mouth, but not suckling or not gulping, you just remove him from the breast. Because anyhow, you are saying that he takes bottle later on. So now if he's crying and he's not coming on the breast properly, then you make sure that you remove him from the breast. No comfort feeding here, because anyhow he takes the bottle afterwards. So you have to make sure that when he comes on the breast, he should do gulping also. So if he is doing gulping, then relax. He is doing active feeding. Next question is from Puvia Yogaraj. 1 hour I am feeding my baby, but still my baby is hungry. See, Puvia, you are also, I think, 1 hour. Who will feed for 1 hour? So that means, Puvia, your baby is not doing an active feeding. You need to see the active gulping movement of your child. If the baby is doing active gulping movement, the baby is drinking. But if you are not seeing the gulping movements, that means your baby is sleeping on the breast. And that's why your baby is still hungry after 1 hour, because the baby was sleeping on the breast. After 1 hour, when you got so tired, your baby was still hungry, you will feel really bad. What I was doing for last 1 hour, my baby is still hungry. And that makes you self-doubt yourself. Is my supply not enough? Is my baby not getting enough? So you need to make sure that your latching should be proper and deep. If you are not able to get this issue resolved, please get a consultation done with my latch expert. She will work with you and will improve your latching. But if you are also giving formula milk to your child, then you need to work on removing the formula by, like I mean to say, on improving your milk supply and also on your latching. Next question is from Shafquat Perveen. Ma'am, my milk supply decreased. My baby is 1 month old initially. I used to pump 4 to 5 times a day, but now my milk supply is decreased. How to improve my supply? So first of all, Perveen, see one thing. Your baby is just 1 month old. So now 1 month old baby takes frequently feedings around 2 to 3 hourly regularly. So your baby would be taking 8 to 10 times feed. Now you're pumping only 4 to 5 times. So your demand is less than what is the baby's demand. So obviously your supply will be less. Now think one thing. Your brain doesn't know that the baby is getting formula milk. So whatever amount of milk your body is producing, the baby will obviously, if your body is producing, sorry, actually I just read Ankita's message. Yes, ma'am, I am the same. Thank you. I got just disturbed there. So one thing, Parveen, what I was talking about, just 1 minute. So nice changes I have started getting, forgetting things. I was telling, yeah, कोई याद दिला दो what I was telling. Your baby is coming on the breast. So anyhow, I'll just tell you again. So I was telling about the demand and supply. So now suppose your baby takes whatever amount of milk the baby takes. Your brain doesn't know that the baby has been given formula milk. So obviously it will keep making the same amount of milk which it has been producing. Now, as a mother, when you see formula milk is increasing day by day, then you feel bad. You feel I am making efforts and still my baby has to depend on the formula milk. And whatever times you're pumping like 4 to 5 times, even that you start decreasing. Array, when I have to give formula milk, what is the use of doing this 4 to 5 pumps also? So you will further decrease your demands. So when you decrease your demand, the further supply will go down. So that's why now you have to reverse the process. So first of all, you have to improve your demand to the brain. So if your baby is not coming at all on the breast, but your baby is just 1 month old, you can definitely improve your milk supply and definitely get the baby also on the breast. Right now, the baby is just 1 month old. For a 1 month old baby, it is easier to bring them on the breast. So now what you need to do, you have to first create the demand. So you have to right now pump regularly, whatever is the amount of feedings per sessions, you need to work upon that. And also keep trying to put the baby on the breast. This I'm telling you, because your baby is just 1 month old. So you can definitely work on that. And other than that, you need to just work on improving your milk supply. So your water intake, your flow of the milk by doing regular massages and hot compresses. Third thing, the charactergogues, which I suggest is lactomagic powder and Morico tablets. Fourth thing, lot of skin to skin with you. And fifth thing, you have to check the baby's weight gain. So all these things you need to do. But I would suggest here, Purvi, since your baby is just 1 month old, and I would not suggest you wasting time here. Just reach out to the team, get the issues resolved fast so that you can get a better results faster, and you can enjoy breastfeeding on a longer run and on a better way. So next question is from anonymous attendee. My baby has a good latch, but he latches for long and does not leave my breast even after an hour. I also have breast pain. So the same thing which I just answered were mother that she is feeding for 1 hour, the same applies for you. And if you're having breast pain also, then definitely it is a human body. It is a breast tissue is your part of the body. And when the baby latches for 1 hour, the pain is inevitable. Obviously, it will be there. And you need to understand, you all would have seen that if you take bath for long, you start getting these ridges on your skin. Now, when the baby suckles on the breast for 1 hour, there is so much of like uh, watery thing on the breast. So obviously, it will be painful. It is like obviously it is painful. So first of all, you need to work on latching. As you said that he had a good latch. So you need to first work on the latching. And obviously, if your supply or flow is less, you need to work upon that also. Next question is from anonymous attendee. Ma'am, my milk supply is low. My baby is 5 months old. I have to give 3 to 4 times of formula milk. How to increase milk supply by hand pressing or pumping? So if your baby is coming on the breast, I would suggest every time when you give formula milk, give half of the amount and then take him back on the breast. And then later on you can give formula. But first do mid bottle feeding and keep checking the weight. And right now your baby is 5 months old and you're just giving 3 to 4 times of formula. This can easily be resolved because 3 to 4 times of formula milk can be like stopped very soon. So, and also because you're 5 months baby, very soon you can start solids also. So get the issues resolved faster, and like after, if your baby starts taking less of the formula milk 1 or 2 times, that you can later on replace with your solids also. So that's all for today. I don't see any more questions here. Good to see all of you are becoming experts. So not much questions these days people are asking. That is good. And good to have you all. Okay. So that's all for today. Take care, everyone. Have a very great weekend and enjoy, everyone. Take care, everyone. And thank you for these hearts. It looks very cute when these hearts are on my screen. It looks very cute. Thank you so much. Thank you so much. Take care, girls. Bye-bye.